Today we're going to be doing a neurological assessment. So coming into the scenario, I'm making sure I have the correct PPE on. So I have my safety glasses on and I have my gloves on. I'm also making sure there are no dangers to myself, my partner, my patient, or a member of the public. So today I have a 14-year-old male here. He is 14, and his name is Fred. Coming in, hi Fred, introducing myself to the patient like always, going through my steps, and then when I get to my neurological assessment. So Fred has fallen off his scooter, so I'm just checking that. So I'm coming in. Fred, are you in a comfortable position? Yeah, so Fred's comfortable, and while I'm doing that, I'm seeing that Fred is talking to me, so he's obviously alert and he's responsive, he's verbally speaking, and he is responding to pain. He's told me he's in a little bit of pain on his right leg. So coming through that, I'm now making sure that I'm checking his head, palpating his head for any signs of trauma on my fast exam. Perfect. That seems to be okay. I'm now going through my seeing, have you had any alcohol today? Any acidosis? Have you had any exposure to acidosis? Ammonia? Are you suffering from had any exposure to endocrine, and any infections? A patient could be overdosing, or a lack of oxygen, which can come into it. Uremia, also could be trauma. Is there trauma to his head, or has he suffered a significant scenario, like a massive blow to the head? Is there a lack of insulin or too much insulin? Poisoning of any sort, which can affect the neurological state, a stroke, a seizure, anything like that through your AEIOU tips can affect a neurological state. So coming on, I'm making sure that his BSL blood sugar level is correct, because that can affect neurologically. So this patient, I'm getting my partner's checked his vitals while I've been doing a neurological assessment, and his BSL is 4.0, which is okay, so we're going to leave it like that. So now I'm grabbing my pen light and I'm checking the eye response, so best eye response. I'm also checking the verbal response, so he's talking to me, and his motor skills, he's moving his hands, he keeps touching his right leg because he's in pain, so that's great. I'm now checking his eyes here, pen light, follow the eyes, follow my hands, perfect. Now moving over to the left. Perfect. Reactivity is good. There's no sluggish movements. There's no delay in eye movements, which is great. I am now coming down and I'm checking so there's no findings on the patient or the family. It's all okay. I haven't had there's no exposure to drugs or amphetamines or anything that could be contributing to AEIOU tips. I now move on to perform condition-specific tests. So I could be doing the Kernig's test, or I could be doing the Brodzinski's test. Moving on now, I'm making sure that I do a cranial nerve exam. So again, getting my pen light and checking. While I do this, I'm also checking again for any bruising that may have come up in the head, in the scalp. Is there any blood in the hair whatsoever? So I'm checking all that while I'm checking with the pen light as well. And then from that, we go on to monitor the patient and go on to further management.